Good day, everyone. Before anything else, allow me to introduce myself and my groupmates. I am Zyrindale Naidas, and my groupmates are Kenneth Maribay, Angelica Matus, Gian Paulo Mina, Rezabel Natay, Asencio Ocampo, Marian Jane Polor, Marian Pastor, and Charlene Pinera. And we are the Group 4, and we will be discussing about the cardiovascular drugs and abbreviations. Let's go first to the cardiovascular drugs to be discussed by Kenneth Maribay and Angelica Matus.
Pleasant day everyone, I am Kenneth Maribay and today I'll be reporting about angiotensin converting enzyme inhibitor to the hypolipidemic agents. First, we have ACE, or angiotensin converting enzyme inhibitor. These are drugs that lower blood pressure by blocking the formation of the angiotensin II. So meaning, these are medicines that help relax the veins and arteries to lower blood pressure. ACE inhibitors prevent an enzyme in the body from making angiotensin II, a substance that narrows the blood vessels. This narrowing can cause high blood pressure and forces the heart to work harder. Moreover, it is also used to manage hypertension, a significant risk factor for coronary disease, heart failure, stroke, and a number of other cardiovascular conditions. Second, we have the angiotensin receptor blocker, or the ARB, also known as the receptor antagonist. These are used to treat high blood pressure and heart failure. They are also used for chronic kidney disease and prescribed following a heart attack. They include irbesartan, valsartan, and losartan, and then candesartan. And third, with the antiarrhythmic agent, these are drugs that regulate the rate and rhythm of the heartbeat. So basically, these are the medications that prevent and treat a heart rhythm that's too fast or irregular. They can reduce symptoms and help avoid life-threatening complications. Some of these drugs stop irregular, extra electrical impulses. Other blocks abnormally fast impulses and traveling along heart tissues. And then we have the beta-adrenergic blocking agent. These are drugs that decreases the rate and strength of heart contractions. These are known as beta blockers. Then we have the calcium channel blocker. Calcium channel blocker is the drugs that controls the rate and force of heart contraction by regulating calcium entrance into the cells. So calcium channel blockers are medicines that is used to lower blood pressure. They stop calcium from entering the cells of the heart and arteries. Calcium causes the heart and arteries to squeeze more strongly. By blocking calcium channel blockers allow blood vessels to relax and open. And then we have the digitalis. These are drugs that slows and strengthens heart muscle contraction. So, bakit nga ba sinabing ganito? Digitalis is used to treat congestive heart failure, or known as CHF, and heart rhythm problems, known as also as atrial arrhythmias. Digitalis can increase blood flow throughout your body and can reduce swelling in your hands and ankles. Then we have the diuretic. Diuretic naman, these are drugs that eliminates fluids by increasing the kidneys' output of urine. Lowered blood volume decrease the heart's workload. So diuretic helps reduce the fluid buildup of the body. Ganun lang kasimple. And then the last one, hypolipidemic agent. These are drugs that lowers serum cholesterol. So ito, pinapababa niya lang yung serum cholesterol natin. So ano nga ba itong serum cholesterol? Serum cholesterol represents the amount of the total cholesterol in our blood. And then that's all. Thank you for listening.
Lidocaine, also known as lignocaine, a local anesthetic that is used intravenously to treat cardiac arrhythmias. Ang arrhythmia or irregular heartbeat is a problem with the rate or rhythm of your heartbeat. Look, diuretics. Drugs that increase urine output by inhibiting electrolyte reabsorption in the kidney nephrons. Nitroglycerin, a drug used to treat angina attacks. Statins are drugs that act to lower the lipids in the blood. Streptokinase, an enzyme used to dissolve blood clots. Tissue plasminogen activator, TPA, a drug used to dissolve blood clots. It activates production of a substance in the blood that normally dissolves clots. Vasodilator, a drug that widens blood vessels and improves blood flow.
Let's proceed to the cardiovascular abbreviations to be discussed by Jan Palomina, Rezabel Natay, Asencio Ocampo, Marian Palor, Marian Pastor, Charlene Panera, and yours truly.
Good day everyone, I am Jan Palomina and I will start to discuss the abbreviation. In the realm of healthcare, abbreviations play a pivotal role in streamlining communication and documentation. This aims to explore and report a selection of medical abbreviations, shedding light on their significance and usage. So first is the ACE or the angiotensin convertase enzyme. ACE enzyme crucial in regulating blood pressure by converting angiotensin 1 and to angiotensin 2. The usage of this is widely associated with medication used to treat hypertension, heart failure, and other cardiovascular conditions. Second is the AE or the automated external defibrillator. This is a portable device designed to deliver an electric shock so the heart and restore normal rhythm during sudden cardiac arrest. The usage of this is commonly found in the public spaces. AEDs are crucial in emergency situations for timely interventions. The third is the AF or the atrial fibrillation. AF is a heart rhythm disorders characterized by the regular and often rapid heartbeats. The usage of this is frequently discussed. A cardiology, AF is a significant risk factors for stroke and other cardiovascular complications. The next is the AMI or the acute myocardial infarction. AMI is commonly known as the heart attack. Occurs when blood flows to the part of the heart muscles is blocked, leading to tissue damage. The usage of AMI is essential term in emergency medicine. AMI requires prompt diagnosis and interventions for optimal patient's outcome. The next is the APC or the atrial premature contraction. APC refers to the irregular heartbeat organizing in the atria, causing premature contractions. The usage of APC is often to observe the cardiac monitoring. APCs may be begin or indicative of underlying heart conditions. The next one is the AR or the aortic regurgitation. AR is a valvular heart disorders where the aortic valve does not close properly, leading to the blood leakage back to the heart. The usage of the AR is significant in cardiology assessments. AR can result from the various causes and may require surgical interventions. The next is the ARB or the angiotensin receptor blocker. ARBs are a class of medications that block the actions of angiotensin 2 used to treat hypertension and heart failure. The usage of the ARB is to prescribe as an alternative or in combinations with ACE inhibitors. ARBs play a crucial role in managing cardiovascular conditions. The last one is the AS or the aortic stenosis. AS is a narrowing of the aortic valve, restricting blood flow from the heart to the aorta. The significant finding in cardiology. AS can lead to heart failure and necessary surgical interventions.
A pleasant day, everyone. I am Zarindale Vinaidas, a BSN 1A, and I'm going to discuss ASCVD, atherosclerotic cardiovascular disease, ASD, atrial septal defect, ASHD, arteriosclerotic heart disease, AT, atrial tachycardia, AV, atrioventricular, BBB, bundle branch block, and BP, blood pressure. ASCVD, atherosclerotic cardiovascular disease. Atherosclerosis is hardening and thickening of the wall of the arteries. This condition can occur because of fatty deposits on the inner lining of the arteries. So when atherosclerosis affects the coronary arteries that supply blood to the heart muscle, a shortage of oxygen delivered to the heart itself may lead to heart attack. ASD, atrial septal defect. ASD is one type of congenital heart disease. Congenital means present at birth. So, ASD is a birth defect of the heart in which there is a hole in the wall that divides the upper chamber of the heart. ASHD, arteriosclerotic heart disease. ASHD is a type of vascular disease where the blood vessels carrying oxygen away from the heart become damaged from factors such as high cholesterol, high blood pressure, diabetes, and certain influences. AT, atrial tachycardia. AT is the type of abnormal heart rhythm or arrhythmia. This is a quiet common, and nangyayari ito especially sa mga may heart surgery and buntis. This can be triggered by infection, stimulant medications, or alcohol. Some symptoms of AT are palpitations, chest pain, heart failure, and etc. AV, atrioventricular. AV is a type of congenital heart defect. It is a problem in the part of the heart that connects the upper chambers to the lower chambers. BBB, bundle branch block. A bundle branch block is either a complete or partial interruption of the electrical pathways inside the wall. BP, blood pressure. BP is common for everyone. It can be used by not getting enough fluids, blood loss, some medical conditions, or medications. Normal blood pressure for most adults is defined as systolic pressure of less than 120 and diastolic pressure of less than 80.
So hi, I am Risabel Sinatay and I am going to discuss the different abbreviations like BPM, CABG, CAD, CCU, CHD, CHF, CKMB, and CPR. So here I am. BPM. BPM stands for beats per minute, referring to the measurement of heart rate. It indicates the number of heartbeats within 1 minute. For example, a heart rate of 70 BPM means the heart beats 70 times in a minute. So let's go to CABG. CABG stands for coronary artery bypass grafting. It is a surgical procedure to improve blood flow to the heart by passing blocked or narrow coronary arteries. During CABG, a blood vessel graft is often used to create a new pathway for blood to reach the heart muscle. This surgery is commonly performed to treat coronary artery disease and restore adequate blood supply to the heart. CAD. CAD refers to coronary artery disease. This means it is a condition where the blood vessels supplying the heart muscle become narrowed or blocked due to build-up of plaque. restricting blood flow to the heart. This can lead to chest pain or heart attacks. An example is a patient with CTE experiencing chest discomfort during physical activity due to reduced blood flow to the heart muscle. So remember that CAD refers to coronary disease, meaning this is a condition where the blood vessels supply the heart muscles. Yun lang. CCU stands for Coronary Care Unit. Coronary Care Unit. It is a specialized hospital ward that provides intensive care and monitoring for patients with serious cardiac conditions, such as heart attack and unstable angina. An example is a patient admitted to the CCU after a heart attack, where they receive close observation, continuous monitoring, and specialized medical care to stabilize and manage their cardiac condition. CHD. CHD stands for coronary heart disease. Sa heart naman siya. It is a condition where the blood vessels supplying the heart are muscle.
CHF.
This means congestive heart failure. It is a condition where the heart is unable to pump the blood effectively, leading to buildup of fluid in the lungs and other tissues. An example is a patient with CHF experiencing shortness of breath and swelling in the legs due to the heart inability to meet the body's circulation needs.
CKMB.
An enzyme found in heart muscle. It is often measured through blood tests to assess and diagnose heart-related conditions, particularly myocardial infarction or heart attack. Elevated CKMB level in the blood can indicate damage to the heart muscle. For example, a patient presenting with chest pain might undergo CKMB testing to help determine if a heart attack has occurred. CPR. In the medical field, it stands for cardiopulmonary resuscitation. CPR in the medical field stands for cardiopulmonary resuscitation. It is an emergency life-saving procedure performed when a person's heart or breathing stops. CPR involves chest comprehension and rescue breaths to maintain blood circulation and oxygenation. An example, administering CPR to someone who has collapsed and is unresponsive until professional medical help arrives.
Good day everyone, I'm Essential Campo. Today I will be continuing the discussion of abbreviation. This includes CRP, CTA, CVA, CVD, CVI, CVP, and DOP. First is CRP, which means C-reactive protein. It's a protein that is made in your liver and released into your bloodstream. Next is CTA, or computed tomography angiography. It's a type of medical test that combines a CT scan with an injection of a special dye to produce pictures of vessels and tissues in a part of your body. CVA, or cerebrovascular accident, is an interruption in the flow of blood to cells in the brain. Next is CVD, cardiovascular disease. This refers to a group of conditions that affects blood flow and blood vessels in the brain. CVI, or chronic venous insufficiency, is a condition in which veins have problems moving blood back to the heart. CVP, or central venous pressure, which is a measure of pressure in the vena cava, can be used as an estimation of preload and right atrial pressure. DOP, or dyspnea on exertion, is the sensation of running out the air and not being able to breathe fast or deeply enough during physical activity.
DVT, or deep vein thrombosis, is the formation of blood clot in one or more of the deep veins located in the body, usually in the leg. ECG, or electrocardiogram, is a recording of heart's electrical activity through repeated cardiac cycle to see how heart is functioning. HDL or high-density lipoprotein or good cholesterol. It absorbs cholesterol in the blood and carries it back to the liver, then flushes it from the body. High level of HDL cholesterol can lower your risk of heart disease and stroke. IABP or intra-aortic balloon pump. It is a device that helps your heart pump more blood. It looks like a long skinny balloon that inflates and deflates. You may only use an IABP when you are recovering from heart surgery or after a cardiac event. LAHB or left anterior hemiblock. It occurs when the anterior fascicles of the left bundle branch is no longer able to conduct action potential that can be seen on your ECG. LDL or low-density lipoprotein or the bad cholesterol. It transports fat molecule around the body in extracellular water. High density, high level of LDL or low density lipoprotein cholesterol raise your risk of heart disease and stroke. To avoid this or to lower your LDL, you must eat food that has high fiber. LF or left ventricle. It is the main chamber of our heart or connects nearly all organ system through its function to pump oxygenated blood to the body. Left ventricle failure would likely to result an impairment to all other organ system. Organs may react to low ventricle function by initiating mechanism to increase blood delivery. LVAD or left ventricular assist device. It is a pump that is used for patients who have reached the end stage of heart failure. LVAD, a battery-operated mechanical pump, which then helps the left ventricle to pump blood to the rest of the body.
Good day and hello everyone. My name is Marian N. Pastor, BSN 1A, and I am here to present about the abbreviations and drugs. Left ventricular end diastolic pressure or LVEDP. Well, it is important in measuring ventricular performance, most especially in determining left ventricular filling and stroke volume to estimate and calculate ejection fraction. Next is the left ventricular hypertrophy. Once LVH is developed, it puts the patient at significant risk in developing heart failure, myocardial ischemic and infarction, or even sudden death. Angiotensin, converting enzyme inhibitors or ACE inhibitors. These medications can help widen blood vessels to lower blood pressure. Myocardial infarction or MI. It is commonly known as heart attack. It is caused by decreased or complete cessation of blood flow to a portion of myocardium. MI may be silent and do undetected, or it could be catastrophic event leading to hemodynamic deterioration and sudden death. Well, millimeters of mercury in adults, blood pressure is considered to be normal under a systolic value of 140 mmHg and under a diastolic value of 90 mmHg. And it has two figures, the systolic pressure and the, the mitral valve regurgitation. The systolic pressure, the pressure when your heart pushes blood out, and the diastolic pressure is the pressure when your heart rests between beats. Mitral valve regurgitation, in this condition, the valve between the left heart chambers doesn't close fully. Blood leaks backwards across the valve, and if the leakage is severe, not enough, blood moves through the heart or to rest of the body. Next is the mitral stenosis. It is the narrowing of the vital mitral valve, meaning it is in which the heart valve that controls the flow of blood from the heart's left atrium to the left ventricle. Next is the multi-gated acquisition. And when we say multi-gated acquisition, it is a nuclear medicine imagining modality that aids providers evaluate the heart's structural and dynamic properties. Next is the mitral valve prolapse, a type of heart valve disease in which the flaps are called leaflets of the mitral valve become enlarged. That's all.
MVR or mitral valve replacement. It is a surgical procedure where the diseased mitral valve of the heart is replaced with a mechanical or artificial valve. The heart has 4 valves and the mitral valve's purpose is to regulate the blood flow through the heart to the rest of the body. PMI or point of maximal impulse. PMI or also known as apical pulse, apex beat, and A-spot is a pulse point on your chest that gives you the most accurate reading of your heart rate. PSVT or paroxysmal supraventricular tachycardia is a type of abnormal heart rhythm or arrhythmia. It occurs when a short circuit rhythm develops in the upper chamber of the heart. PVD or peripheral ventricular disease is a progressive disorder that restricts blood flow to the arms, legs, or other body parts. It occurs when blood vessel narrows, become blocked, or spasm. It can lead to pain and cramping. PVD also describes the reduced circulation of blood to a body part, which is the brain, and the heart is not included. SVT or supraventricular tachycardia. It is a condition where a heartbeat is abnormally fast. SVT is also called paroxysmal supraventricular tachycardia. VLDL or very low density lipoprotein. Lipoproteins are a combination of proteins and fats found in your blood. They are categorized based on their density. VLDL is regarded as bad cholesterol. Your liver makes VLDL and releases it into your bloodstream. The VLDL particles mainly carry triglycerides, another type of fat, to your tissues. VSD or ventricular septal defect. It is a hole in the heart. It's a common heart problem present at birth. The hole occurs in the wall that separates the heart's lower chambers. VT or ventricular tachycardia. It is a type of abnormal heart rhythm or arrhythmia. It occurs when the lower chamber of the heart beats too fast to pump well and the body doesn't receive enough oxygenated blood.
That's all for the cardiovascular drugs and abbreviations. Thank you for listening and hope you guys learned in our discussion.